So this is our patient Kimberly. She was involved in several car accidents and an injury with a massage therapist trying to adjust her. So a lot of times when you have injuries, your muscles tense up and your joints get restricted, and a lot of times they need more movement. Each vertebra and each joint needs independent motion. Sometimes if the ligament is overstretched or torn, it can cause instability to the neck. So in her case, it's a little different. We want to be creating more strength in the muscles of the neck. So here are some exercises that you can do if you feel unstable and you experience migraines or headaches. What I'm going to have her do is I'm going to have her put her right hand over her right ear, and she's going to isometrically hold this position, putting resistance into her hand for about 10 seconds. She's going to do the opposite side. She's going to get both her hands, put it over her forehead, and she's going to put resistance into her hands in that plane. Lastly, she's going to put both her hands at the base of her skull. She's going to hold that for about 10 seconds. Okay. So there are several tests that you can verify neck instability, like the sharp pursor test. Also, it will show up on x-ray if you can kind of see overhanging margins in an open mouth cervical x-ray.